thoughts on some global issues, and I want to just give some information that I thought was very helpful from the World Health Organization, as well as some information from the Joe Rogan Experience, which he interviewed a doctor, Dr. Michael Osterholm, who has some very important information that I think we all should be mindful of. So in this sit down, we're going to talk a little bit about what's going on what to expect in the coming weeks as the coronavirus unfolds. So we're going to play the first few moments of the Joe Rogan Experience to hear from Dr. Osterholm on his perspective of what's going on with the coronavirus and why we have to, look forward to literally enduring this challenge. Here we go.
So what you said when you sat down was absolutely perfect, that the timing could not have been better. Well, tell everybody what you do, Michael.
Well, thank you. I'm, for lack of a better term, a medical detective. I've spent my whole career tracking infectious diseases down, trying to stop them, trying to understand where they come from so we can make sure they don't happen in the first place, but most of all, trying to respond to situations.
And just off the bat, how serious is this? Is this something that we need to be terrified of, or is this overblown, or how do you stand on this?
Well, first of all, you have to understand the timing of it in the sense that it's just beginning. And so in terms of what hurt, pain, suffering, death has happened so far is really just beginning.
Yep.
This is going to unfold for months to come yet, and that's, I think, what people don't quite yet understand. What we saw in China, I'm convinced, as are many of my colleagues, as soon as they release all of these social distances, these mandated stay in homes, haven't left their home in weeks and weeks kind of thing, when they go back to work, they're on planes, trains, subways, buses, crowded spaces, manufacturing plants. Even China is going to come back again. And so this really is acting like an influenza virus, something that transmits very, very easily through the air. We now have data to show that you're infectious before you even get sick. And in some cases, quite highly infectious. Just breathing is all that you need to do. So
that was the first in hearing that just breathing can spread the coronavirus. That's something that a lot of people have kind of wondered about and has been concerned about. And as this doctor is saying, this is so different because the way it behaves and the way it moves is far more aggressive and stealth than other influenza in the past. We're going to listen to what Doctor has to say some more.
So from this perspective, I can understand why people would say, well, wait a minute, flu kills a lot more itself every year than this does. And I remind people this just was beginning. Probably the best guesstimate we have right now on what limited data we have would say this is going to be at least 10 to 15 times worse than the worst seasonal flu year we see.
10 to 15 times worse in terms of fatalities?
Yeah. And just illness. In fact, I brought some numbers. We conservatively estimate that this could require 48 million hospitalizations, 96 million cases actually occurring, over 480,000 deaths that can occur.
Now, he said 48 million hospitalizations, close to 500,000 fatalities as a result of the coronavirus. That's because this virus spreads exponentially. And that's something, again, we don't wish that or hope for that.
Pre-antibiotic days, the old-time medicine. We have an employee at our Center for Infectious Disease Research and Policy at the University of Minnesota, and she has a dear friend who lives in Milan, Italy, and she works at a hospital there. And she texted this to this employee of ours last night. And this was an email that came out yesterday from one of their physicians in Milan.
So here comes a description of what's going on in Milan, Italy. And I want to, after we hear from this, I'm going to share with you a snippet of another letter that came out of Italy that talks to what is going on and what it felt like before and after coronavirus truly hit. So have a listen.
At the largest hospital there, and he said, I just got a very disturbing message from a cardiologist at one of the Milan's largest hospitals. They're deciding who they have to let die. They aren't screening the staff anymore because they need all hands on deck and they have very small areas of the hospital dedicated to non-COVID patients, where they still screen doctors. Everybody else is dedicated to COVID patients, so even if they're positive, meaning that they're sick, but they don't have a severe cough or fever, then they have to work. He says that they're seeing an alarming number of cases in the 40-something age range, and these are horrible cases. So we need to stop thinking that this is only an old person's disease. This is what I'm going to unfold, not just in Wuhan, it's unfolding in Milan, it's unfolding here in Seattle, and this is what's going to continue to rollingly unfold throughout the world.
Yeah, where did this rumor come from that it's an old person's disease? Is it just because the majority of the people that have died from it so far have been older?
Yes. In fact, that's the primary risk factor for dying, is being old and then having certain underlying health problems. For example, in China, those men over the age of 70 who also smoked, 8 to 10% of them died. 65% of older Chinese men smoke.
Now, this just came in. The NCAA just ruled that only essential staff, family members will be able to attend Division I championship basketball games. So everybody, this is becoming, something that we never really expected. As you already know, a few weeks ago, nobody really knew what the coronavirus was. Go back to President's Day weekend in February. It was a blurb in the news about people getting sick in China. But the problem is it wasn't contained when it really popped up in November and December of 2019. And that's something, again, that, you have to look at and wonder why the leadership, be it here in the States or abroad, didn't really work more aggressively to contain this now global pandemic known as the coronavirus. So I just want you all to take that into account, because it's not just targeting any age group. Dr. Osterholm goes on to talk about later in his interview about how kids, they're getting infected, but they're not getting sick. They're more like a virus carrier than a virus, a victim, let's say. And they're bringing it to other people in the family, mom and dad. They're bringing it to their grandparents.